Today, I'm going to be talking about hemorrhaging as a medical emergency in the dental setting. Bleeding can be completely normal during treatment, but certain medications and health conditions can increase a patient's risk for more serious complications. In this presentation, I'll go over how we identify risk factors ahead of time, how to recognize when bleeding becomes abnormal, and the steps that we can take to manage the situation safely. Before we even start treatment, we need to recognize anything that could increase a patient's bleeding risk. Anticoagulants like warfarin, recent aspirin use, and their INR levels all give us important information about clotting. Reviewing the medical history and vitals helps us understand what type of bleeding is expected and what might be a warning sign once we begin care. During treatment, we want to watch for signs that bleeding is becoming abnormal. Bleeding that doesn't slow down with pressure or starts flowing more quickly can indicate a problem. Patient symptoms like dizziness, weakness, or pale skin are also red flags. A drop in blood pressure or an increase in pulse might point towards hypovolemia, and that's when we know that we are dealing with a true emergency. When bleeding becomes uncontrolled, the first step is to stop treatment immediately and apply firm, direct pressure with sterile gauze. Hemostatic agents like gel foam or topical thrombin also support clotting when pressure alone isn't enough. We also want to position the patient safely, provide oxygen if needed, and activate EMS when bleeding isn't improving. Quick and calm action is essential for managing this type of emergency.
Preet?
Hi.
Hi, welcome in. My name's Michelle. I'll be your hygienist today.
Hello.
We're just gonna head back here, okay?
Here, I'm gonna put this up here.
Have a seat right here.
Thank you.
So I see you're taking warfarin 5 milligrams daily, right?
Yeah, every night.
Okay. And this is for your atrial fibrillation?
Yes it is, but I've been taking it for a few years now. Like, I started in 2022.
Okay, got it. Thank you. Do you know when your last INR test was checked and if your doctor mentioned the results?
Oh yeah, it was just 2 weeks ago, and I think it was about around 2.5. I'm not 100% sure.
Yeah, perfect. Well, that sounds like it's right around the normal and safe range. Thank you for letting me know. I also noticed that you marked here that you recently took aspirin. Is that correct?
Yeah, I was having some headaches, so I took aspirin.
Okay, good to know. Aspirin can actually increase bleeding. Usually that's pretty minor, but since you're already on warfarin, it can actually make you more prone to bleeding. For headaches, drugs like Tylenol or acetaminophen is a better and safer choice, okay?
Oh, I didn't know that.
No worries. This is why we always review medical history before treatment. Let's go ahead and check your vitals.
Okay.
Okay, I'm gonna go ahead and take your vitals.
Okay.
Grab your left arm, slip that cuff on. Perfect. Then you can relax. Okay, blood pressure 145/88, pulse 94, respiration 14, temp 98.2. Everything looks stable. Let's begin treatment.
Okay.
As we position the patient, we're preparing for scaling and root planing. This procedure removes biofilm and calculus from above and below the gum line. Because our patient is on a blood thinner, there's a higher risk of bleeding, so I'll be working gently and monitoring closely. Proper technique and preparation helps minimize bleeding and keeps the patient safe. Here we can see a small amount of bleeding along the gum line. This is common during scaling and root planing, especially in patients taking blood thinners. Notice how the bleeding is slow and controlled. This is why we apply gentle pressure with gauze later on. Managing minor bleeding helps prevent it from becoming a more serious hemorrhage.
I noticed a little bit of bleeding around the gums. However, with your medication, that is expected.
I can taste some blood in my mouth.
Okay, that's normal. Don't worry. I'll apply a little bit of gauze and some pressure. Okay. Looks like it's slowing down nicely. Let's keep going carefully.
Okay.
Okay.
It feels like there's a lot of blood in my mouth now.
Okay. We will stop right there. Go ahead and bite down gently on this gauze.
At this point, the patient is experiencing more noticeable bleeding. The first step is to stop the procedure and apply firm pressure using folded gauze as seen in this clip. Have the patient bite down gently to maintain pressure directly on the bleeding site. This helps the blood start to clot and is usually the most effective initial step in controlling oral bleeding, especially in patients on anticoagulants.
I'm gonna sit you up. Excuse me, can I get some help over here? Hi, can you get me some gel foam? Oh yeah. Thank you. Okay, thank you.
Now that we have the gel foam, it's placed directly on the bleeding site. This absorbable sponge helps promote clot formation and is especially useful for patients on blood thinners. While hygienists don't typically administer it, it's important to understand how it works. Here, I am noticing that my patient is looking pale and feels dizzy, so we're going to check vital signs again to assess for any complications. Here, I'm reassessing the patient's vital signs to monitor for any changes. The blood pressure has dropped and the pulse has increased, which may indicate hypovolemia or early shock from blood loss. When we see low blood pressure, rapid pulse, dizziness, or paleness during active bleeding, it's essential to stop treatment and call emergency medical services.
I've got a medical emergency. Can you call emergency services and bring me the oxygen tank?
Okay, this is
Here is the oxygen tank for you.
Thank you. I'm just gonna lay you back here. Awesome, you're doing great. Keep pressure on that gauze. And oxygen here is going to help while we wait for EMS.
That was intense.
Yeah, it was, but we did do everything by the book. We stopped the procedure, applied direct pressure, we used gel foam, called 911, administered oxygen, and monitored vitals.
And aspirin definitely made things worse.
Exactly. Aspirin prolongs prothrombin time and inhibits platelets, so combining it with warfarin increases hemorrhaging risk. She'll definitely need to avoid aspirin for next time, or NSAIDs and certain herbal medications as well. Acetaminophen is always the safer choice.
Right? And I feel like controlling the inflammation and having good oral hygiene is also a key in this case.
Yes, preparation is always key.